We are now just 2 years away from the year 2020, and I would like to begin by asking the Ministry of Health to give an update on the progress of the Healthcare 2020 Master Plan. The budget statement that was delivered last week gave us a stark reminder that although Singapore may be one of the healthiest nations in the world, we have a healthcare system that is admired by many, and Singaporeans may be amongst the longest living, but with our aging population and a growing chronic disease burden, healthcare expenditure is rising, and it is rising very quickly. The Ministry of Health's operating budget has risen from 5.87 billion in financial year 2014 to almost 9 billion for FY 2018. Now, in an effort to maintain the relevance and sustainability of our healthcare system, MOH earlier outlined its chief strategies to transform our healthcare system to meet the challenges of the future, with 3 key shifts. The first was moving beyond healthcare to health. The second, moving beyond the hospital to the community. And third, moving beyond quality to value. And I would like to comment on these proposed shifts. First, moving beyond healthcare to health. Over the past few years, the focus on health promotion and maintenance has been unrelenting, and I applaud all Singaporeans for rising to this challenge. The call to arms to fight diabetes has reverberated through our society. We are all exercising more, eating more brown rice, for instance, saying no to sugar and no to overeating. And I appreciate the many initiatives and the nudges that we are making to make Singaporeans choose a healthier lifestyle. For instance, where I work, all of the kopitiams and coffee shops no longer put sugar in their beverages. That means coffee and tea. And if you want to, you actually have to add it yourself. So it's initiatives and small little measures like this, I think, that will help our fight forward. And I look forward to more initiatives from MOH and the Health Promotion Board to promote healthy living in Singaporeans. As in every battle, it would be a mistake to step back when the tide is in our favor. I would like to request an update from MOH regarding its strategies for promoting healthy lifestyle choices among Singaporeans. Now, second, moving from hospital to community, and I have voiced my strong support for the right siting of medical care to the community wherever possible. And for this to be possible, we have to continue strengthening both our primary care and ILTC, or intermediate and long-term care sectors. I'll speak on primary care transformation later, but at this juncture, I would just like to ask, what are our efforts? Are our efforts to increase ILTC manpower and infrastructure on track, as detailed in the 2020 Master Plan? Now, this call to shift from the hospital to the community also heralds another key theme that was announced in this year's budget statement. Many members have already spoken on this, but I was heartened, like the rest, by the announcement that health and social services will be more closely integrated. And this is because there is clear evidence from around the world that the health of an individual is closely related to one's socioeconomic status. The wealthier also tend to be healthier. A recent study from the USA using data from the Centers for Disease Control confirmed that people with higher incomes live longer and have better health scores in virtually every parameter. One commentator even went so far as to suggest that, quote, being rich is the best healthcare plan that America has to offer, unquote. Closer to home, and as the member Dr. Tan Wu Ming had alluded to in an earlier speech, a study in Singapore also noted that if you use public rental housing as a measure of socioeconomic status, then this in itself is independently associated with increased hospital readmission risk and being a frequent hospital admitter and also an emergency department user. Now, there could be many reasons why people with low incomes have poorer health scores. The most obvious would be access to healthcare, but this is probably less true in Singapore than in other countries because our comprehensive healthcare system with universal coverage and very targeted subsidies has tended to flatten inequities in medical coverage. What then about other factors? Now, poorer health has also been associated with educational level, which itself correlates with lower income. People with lower educational status, however, are not necessarily less knowledgeable about health compared to those with higher education. And allow me to elaborate with 2 examples. Now, we all appreciate that one of the most important paths to good health is to exercise good food choices. One study looked at why children coming from wealthier better educated parents grew up preferring healthier foods and were ultimately healthier. Now, I think it's important before we go into to understand that where children are concerned, research has shown that kids may actually need to try a new type of food about 8 or up to 15 times before they can accept it and perhaps grow to like it. So what the researchers found was that while parents from all backgrounds understood which foods were healthy and which were not, eat more veggies, less fried foods and so on and sweets, parents who were less educated and with lower incomes often did not persist in offering healthier foods to their kids. And this could be because of the steep upfront costs in introducing these foods to children. And let's take vegetables, for instance. If a parent were already working within a tight budget and time was short and the child refuses to eat broccoli, for instance, then they would be less likely to persist with it because the child would probably refuse or end up on the floor. And they would soon give up and say, okay, maybe we'll just give them the chicken nuggets that they are clamoring for. A family who is wealthier may perhaps have the luxury to be able to continue offering this food, even though the broccoli ends up on the floor 10 or 15 times, until the child learns to appreciate it. So in line with this, let me call on the ministry to continue working with NOE and our schools to ensure that only healthy foods be served to our children. I understand the constraints that some families will face in regard to food choices at home, but I hope that our schools can play a bigger role towards inculcating healthy eating habits in our young, and I feel that this should actually start at the preschool level rather than just at the primary school level. Another example closer to home. Now, some years ago, a team from the Sosui Hawk School of Public Health worked with myself and my grassroots volunteers to conduct a health survey in one area of Queenstown. Now, this survey reached out to almost 3,000 residents and was conducted over a period of about a year. It was a very good study, but I think one repeated observation that I got was that residents who had higher educational levels were less likely to smoke, and they were more likely to go for health screening, such as colonoscopy for colon cancer, mammography for breast cancer, and pap smears for cervical cancer. And the researchers actually found that this difference was not due to any knowledge gaps. If you ask people from all educational levels whether they knew what mammography was and why it was important, I think the knowledge was the same. Whether you came from a low or high educational background, you understood the importance of it. It was just that those from higher educational levels actually made that extra effort to go ahead with the screening. Thus, it is clear that an important determinant of health inequity is also social inequality. And as we strive to be a healthier country, we should never lose focus on enhancing social mobility and reducing social inequities. In the meantime, I hope that this new compact between our social and health services will allow us to deep dive into the social circumstances of our lower-income fellow Singaporeans to give them the support that they need to achieve a long and healthy life. I hope that the ministry would be able to share more about the proposed integration of health and social services, as I feel that this would go a long way towards flattening the social gradients in the health of our population. And finally, from quality to value, and this is a tricky subject, because what is value in healthcare? Just as the quality of health services is sometimes difficult to quantify, what represents good value in medical care? Of course, value is important, because if we are counting our pennies, we have to ensure that healthcare remains affordable by ensuring that we get the best outcomes for the lowest financial outlay. Budget 2018 is frank and upfront about the financial pressures that our nation is likely to face over the next decade, and healthcare spending is one of the areas that see the greatest increase in public spending. Value-driven healthcare policies could be a significant avenue of ensuring the sustainability of our system. So our healthcare institutions were recently reorganized from 6 clusters to 3. This was announced last year. And can I ask if this has led to any desired gains in efficiency and value of care delivery? I've also previously asked for a body to be set up to evaluate not only the efficacy but also the value of various medical and health-related interventions, whether diagnostic or therapeutic. So I'm glad that we now have the Agency for Care Effectiveness, and I call for ACE to play a bigger role in our quest for value and clarity in our healthcare spending. Some interventions may seem very promising, but with uncertain benefits. And, they are controversial. For example, things like hypertension, hyperlipidemia. At which point should we actually choose to treat otherwise healthy individuals with medications? New technologies, remote consultations. Some studies have shown that although it's easier, but it tended to increase the utilization of services with no discernible improvements in health outcomes. So in conclusion, the health check for our healthcare system is good for now. But just as our economy needs to transform itself to position itself for the future, so too does our healthcare system, which needs to see through its transformation to continue serving our country well beyond 2020 and in fact beyond 2030. Thank you, and I'm back to Move.